The National Joint Registry is such a powerful tool because it has so much patient data in it. Without this, we would not be able to have done work such as looking at the risk of mortality after joint replacements. We would not have been able to do the work looking at resurfacing and metal hip replacements, and we'd certainly not be able to do the granular work showing how different implants survive different times in different age groups and genders.
By contributing their data to the National Joint Registry, patients are enabling us to do important research that will help the patients of the future get the best outcomes from their hip and knee replacements. A good example of this is a recent research paper from the University of Bristol that has looked at which are the best hip replacements and which are the best knee replacements on the market in the UK. And this allows patients, when going in for their hip or knee replacement operation, to decide with their surgeon what suits them and what they feel comfortable with to give them the longest lifespan from their hip or their knee replacement.
Being part of that process of providing information and helping move our health service and this particular area along is something we should all want to do. You know, it's part of our responsibility as citizens and patients, is to help enhance other people's experiences.
The data that the National Joint Registry actually collects is related specifically to the patient, their name, their NHS number, their personal details, the surgeon that undertook their operation, the nature of the operation. The NJR uses its data by publishing for different key stakeholders. So we have a management information system that goes to trusts, clinician feedback so that surgeons can monitor their own performance, supplier feedback where implant manufacturers can actually go on and look to see how their devices are actually performing, and the device regulator, the MHRA, can actually have sight of that as well. But more specifically is patients can actually go onto the web and see how units and surgeons and implants are performing. And when they go to see a surgeon, they can actually have a very informed conversation, and that at the end of the day has got to be of total benefit to patients, which is what we're about.